The Nevada Minority Health and Equity Coalition Public Policy Workgroup presents Advocacy and Policy Change. Thank you for joining us for another in our advocacy series. I'm Tom McCoy, Executive Director, State Government Affairs for the Nevada Chronic Care Collaborative and co-chair of the NMHEC Public Policy Workgroup. Joining me is Steve Messenger of the Nevada Primary Care Association. And Steve, the obvious question, I'm sure, from some of the viewers to this session is, what is NPCA?
So thanks, Tom. Thanks for having me here, and thanks to the Nevada Minority Health and Equity Coalition. The Nevada Primary Care Association is an association for federally qualified health centers in the state. And so what a federally qualified health center is, a specially designated and federally funded clinic or organization of clinics that has a lot of special features. So the idea came out of the civil rights movement to provide healthcare to underserved communities and populations. And so they're clinics that are basically granted to provide care and required to provide care to patients regardless of ability to pay. One of my favorite features about them is that they're required to be governed by the patients that they're serving. So a majority of their board is going to be from the communities that they serve and directing exactly what those, communities need as far as care. And the other, really great feature is that they're required to have either on site or within the organization or via contract comprehensive care arrangements. That means you're not getting access just to medical care, but dental care and behavioral health services, substance use disorder services, and any kind of like enabling services. One of the nice things about these clinics is that they have the resources to kind of put the glue together. So if some of their patients need transportation or help covering their prescription drug costs, there's resources available for that. So there's about 1,300 of these organizations across the country. We have about 8 of them in Nevada, but that represents about 60 clinic sites. And Nevada Primary Care Association is the state association for those organizations and kind of peers with similar state associations in every state in the country that likewise represent their FQHCs.
In Nevada, would that include tribal clinics?
We do include tribal clinics kind of in our charter, and when we were founded, it was very much in tribal clinics. We're kind of rebuilding that participation, and the designation of FQHC applies to tribal clinics, but kind of in a oddly different way than it does to the majority of our members.
Okay. So we know a little bit now about NPCA. What about Steve Messenger? What do you do for the association?
So I have the pleasure and privilege of being the policy director. I basically work with the federal government to ensure that that the grant continues, but mostly it's our job to explain to our members of Congress what they're getting for their investment. And then, the health centers are one of the last truly bipartisan institutions in the country, because they're designed to serve underserved populations. They do really well in like inner cities across the country, but they also do really well and sometimes are the only options in rural communities. In Nevada, a good example of that's like Elko County, where we have like 5 different clinic sites, kind of anchored by Elko, but also extending to the corners of the county, which Elko County is about the size of West Virginia. So that can be really important to have that kind of consistency of care where the clinic that you're working with in West Wendover has its hub in Elko and has its main organization in Carson City, brings a lot of resources to a very small area. I also work with the Nevada legislature on the odd years that they are in session. And that work is primarily just to translate relatively obscure flavor of federal clinic and optimize Nevada policy to take advantage of the features of that, federal program.
So is the PCA able to support legislation, or is there any restrictions on that?
We are. I mean, we have a federal grant that pays us to provide technical assistance and training to the health centers. But we also have, membership funds. We just finished our annual conference. So to the degree that we can find other funds, it's not a huge part of what we do as far as, asking for legislative change. But we do a lot of work in education. So, like I said, educating both Congress. Well, Congress is the one that's really investing, but also educating the legislators in Nevada. Here's the resources that you have that you
Mhm.
might not know that are available to your constituents. And so when we need little policy changes or some money here and there, how can you help the health centers in a way that benefits your constituents? And yes, we are able to do that work.
I think it would be interesting, since you have a statewide association and members in all the corners with urban and rural issues. How do you come up with those policies that you are going to support in Carson City, or maybe react to a policy that is seen to be not in the best interest of the association?
Yeah, fair. It's been I've been here at this. It'll be 10 years next year, so it'll be kind of my decade session. And it's been very obvious what we were going to support. Nevada has had a very logical progression into what I would call community health broadly. So when I came to the 2017 session, I think was the first one I really kind of knew what was going on. There was a big push both at the state and grassroots level to improve, for example, community health worker policy. The PCA is in a position uh, to both recognize that as a potential for the health centers that's kind of coming down the pike and support something like that, which then evolves into the most progressive community health worker reimbursement through Medicaid in the entire country. Um, Nevada is the only state, at least it was last year. Maybe we won't hold out for very long as everyone follows us for a change. Um, but it's the only state that would pay the health centers basically their full encounter rate. And I don't want to get too fancy, but health centers, they get basically an encounter rate where the patient, no matter what the services are, it's the average cost of the visit, and that's what they get. And so it's really important that that encounter can be delivered by a physician. But in Nevada now it can be delivered by a community health worker, and the reimbursement is the same because it's just that average encounter. And that makes a community health worker really valuable and able to. We're about to see the evolution of that model of care, of what it means to have a community health worker, really grow because we have the policies to invest in it. So that's again an example of something that's kind of bubbling up from the bottom, that we say, hey, this will be useful, and we pull forward and we put it in front of our members, and they say, yes, that sounds great, run with it. There are other things that we get a lot of advice from our national organizations. The things that are impacting our health centers are the same things that are impacting health centers in states across the country. So, for example, we're about to push um, a protection for a prescription drug program modeled after a bill that passed in Louisiana, for which we just found out this week the lawsuits have all been settled and the state won. So now we know that, like, we've got this model legislation from another state that solves a problem that we have in our state. They've already gone to the expense of drafting that legislation, and now they've already gone to the expense of defending that legislation in court, and it's prevailed. So now we can move forward with that. And that's something, again, that it's a problem we already had identified, but a solution that comes from outside.
That's a good entry for me to say, okay, you've got this issue, you're going to be bringing it forward in 2025. How best to get a legislator individually, collectively aware of it and in a position from your standpoint to support it?
Yeah, I hope someday to really speak to individually. It's not a game I really played because I represent my association. And so that's kind of my hammer. The only tool I've got is an association, and that's what I'm going to recommend. The most powerful way that I know to affect the legislature, any governing body, is to gather with the other interested parties who nobody's going to make legislation because it's a problem for Tom McCoy. But if you can show that you have a whole group behind you for whom this is a problem, or it's not even a problem, we're going to make progress on it. This is something that's never been addressed, and we see the way forward, and we want, public resources to be addressed in this way, or public policy to be changed in that way. Gather your friends, number one. And then number two, heard a great quote early on that data is the currency of advocacy. Get your data. If you can't quantify your problem, then it's just something that you said, right? You have to be able to show with actual data that's, authoritative and respected and respectable and accurate and not, manipulated. You have to be able to show what's going, both the value. So for me, it's the value of what we're doing already, and it's the potential of what we could be doing. So those two things: get your friends, get your data, go in together and tell your story. We do this every year at we do this every year at the national level, and we do this every other year at the state level in Nevada. And those big visits are the anchor of our relationship with the Nevada legislature and the Nevada delegation to the US Congress, right? They know us because we've been in their office with all our friends and our data from that visit. And from there, it creates a cycle of ping pong. The legislator will ask questions. You'll say, I'll get that answer for you. You'll get that answer for them. That's the most important thing. They want something from you, and that's what you came for. You came to get them wanting something from you. You came to deliver something to them because you asked them to deliver something to you. So give them what they want, and then the next time there's any update on what you want, keep them in the loop, touch base. Don't just come around when you need a vote. Come around with a great story. So for me, it's my members send out newsletters. They're fundraising, right? And they're saying, look at all the good we did. Here's this patient profile, and I'm going to say, hey Tom, Assemblyman McCoy, here's this great story of this patient that's your constituent and what my member did for them. I'm not asking for anything, but we met earlier when I was in your office, and we've been asking for this policy change, but I just saw this and I, thought of you because it's your constituent. Keeping up that relationship all the time is our secret, is my process.
Thanks, Steve. There are 5 videos in this series. We encourage you to hear the perspectives of other public policy workgroup members on another advocacy and policy change.